Oh! A hot cup of coffee spilled right into your crotch.
And hot.
That skin in between, you know where, is like super sensitive, super thin. Can get first degree, second degree, even third degree burns. Oh no. Oh my gosh. That individual has no chance at that point. I don't care if you have airbags or a seatbelt. We all know this. You don't need to be a doctor to figure this out. Oh, gentleman slammed right into a tree. You're thinking severing your spinal cord because of the amount of force that you land into a hard, and then your bike comes in again going 40 to 60 miles an hour, right either in your legs or the abdomen. It just depends on where it hits you. With this car flipping, we actually see a lot of people that actually fly out of the car. And so when EMS gets on scene, we always ask, where was the individual found in relationship to their vehicle? Were they tossed from it? Did they just get out of it? Oh my gosh, still alive, simple injuries, scratches, you're wearing the seatbelt. Obviously, everybody wears a seatbelt. The airbags might have not been in, they might have not deployed because of not as much frontal injury. Oh my gosh. Like, these are the worst luck ever. We do see people that come in after a car has been on fire. You do worry about not only just like burns, but the materials that are burning. So you always worry about like potentially cyanide poisoning. The SUV slamming into the tree again, flipping over. Survivable? Yes. EMS will probably put you on a backboard, put you in a seat collar. Oh my gosh. Holy cow. Okay. A water bottle getting stuck underneath the brake. It's not unrealistic. So just be careful what you have in the car and keep any obstructions away from the driver's side at least. Oh no.
It's way too warm in here now, huh?
Tanning bed. Huh? Tanning beds, no good, okay? They increase your exposure to UV radiation, which then increases your risk for skin cancer, melanoma, as well as aging of your skin, thinning of your skin. Oh my gosh, melting. Oh, it's getting shattered. The glass is shattering, so you worry about like simple lacerations. Likelihood that you're going to lacerate a major artery is probably pretty low because most arteries are quite protected by where they are anatomically in our body. Oh my gosh, dude. I was not ready for that. This is awful. Really, there's not much to do at this point. You have melting of your airway potentially as you breathe in the flames. You're having the fire itself taking the oxygen away from you in that area, so you're becoming hypoxic. So you have a double whammy. That's so much. Oh, I see what's happening. He's going to drown. He's panicking, which then is going to decrease the ability for him to hold his breath, and he's going to run out of oxygen quick. Stop it. I have literally seen where somebody's rectum prolapses, aka comes out.
Put her back in.
Like literally involutes the other way. So it looks like this big sausagey looking thing, and it's very tender, it's painful. There's a nerve endings, it could bleed. What? I don't know anything about pools except going in them is fun and hanging out with your friends, but could it actually do that to somebody? That's crazy.
I can't move my head.
Perfect. Just what we want. Here comes the drop.
Okay, so device so you don't move your head. I'm assuming this is like an ophthalmologist putting drops in the eye.
And you will feel a little numbness.
Numbness drops. So we typically use either tetracaine or proparacaine. All the meds that end in cane pretty much are the anesthetics. So lidocaine, bupivacaine.
Relax.
Oh my God, the ominous music. Don't tell your patient to relax. It's really an inappropriate word. It's really hard to relax when somebody's sticking metal in your eye.
Is that supposed to be happening?
Where's the doc? Typically, a ophthalmologist would do this potential laser therapies. A lot of times when somebody is in these type of devices, they're doing other therapies by hand versus the machine. Somebody needs to be manning the machine, somebody needs to be around. Slow, man, oh my gosh. I'm not an eye surgeon. Not for me. Wow, look at that. It's like cutting through regular flesh and tissue. Watching these movies, they definitely get you worked up, excited. My company, Life Happens, we have chillax for those occasional stresses. And then we have Do Not Disturb, so you can turn your brain off at night.
What is it, Norm? Wait.
Those hooks are prosthesis for individuals that obviously don't have an arm, and the hooks help grab. That's why those are there. Oh no. Oh my gosh. Could blood come out of your mouth? Because we know that is the view that we all get in movies, shows. In this circumstance, it actually could work in the sense of crushing an airway, crushing the neck. Oh. Oh my gosh. What would you do if that happened in real life? Decapitation. You lose the connection of the brain to the body, so heart and lung function will cease because there's no more information. You still have oxygenated blood in your brain, but is there consciousness? That is the $1 million question, and really nobody knows the answer to it. The likelihood is no.
You in trouble, Roy.
Oh geez, of course, electrical. They're wearing their hard hats. Where's your hard hat? If heavy machinery is going to hit you on the head, is a hard hat really going to help that much? Probably not. It still causes a massive amount of brain trauma, skull fractures, and pieces of brain. It's good for minor injuries, obviously not for big major. Oh my gosh, that would have hurt significantly. Oh, why is he bleeding?
Oh my goodness.
Puncture wound right through the soft tissue underneath your mandible here. Could that actually happen? Yes.
Yes.
Would it necessarily kill you? Unless it goes directly through your brain. Not necessarily, actually. We see a lot of people who get these type of soft injuries through the mouth, through the hard palate, maybe into your sinuses. Oh my gosh, that went right through the front part of your brain.
Oh no, my brains.
Now this will cause significant amount of bleeding, brain trauma, and will eventually kill you. But instantaneously, probably not.
Did you feel that? What? Something's wrong.
Oh. Sometimes we have that feeling inside of our bodies, our intuition that something's not right.
I got a bad feeling about this.
Typically, it's your own warning sign, especially if you don't have a history of significant amount of anxiety or panic attacks. You know, you should listen to it, just something to be aware of. Oh my gosh. You can see all the rebarb and concrete just like disintegrating after just one missed move. Interesting. Oh, come on. Come on! They're showing us what appears to be the classic intestines coming out. Remember, they're attached by the mesentery, so they're not one big string. They're actually attached to each other, and they're overlaid by the omentum. Oh my gosh. Scalding injury. You probably even burn off your eyes at that point. We do treat people who have burns that bad to where they're having these horrible second, third degree burns. When it gets to the head and neck area, you get really worried about constriction of your airway or swelling of your airway. Oh gosh. Oh man.
Oh man.
Right through the base of the skull, the big hole where the spinal cord comes out, the foramen magnum probably just severed the spinal cord and straight through the face because it's low, right? So it could go through the cerebellum, which is that lower part of the brain. Oh my gosh.
My God.
Not cases that I would see come to the emergency department because they're pronounced on scene. We do see people that get impaled with different objects and definitely want to shorten them. Typically they're taken out either in the emergency department or in the operating room, but a surgeon needs to be involved.
How much stuff is stored up there?
Never-ending shelf of stuff. We see people come to the emergency department where mirrors fall on people, TVs fall on individuals, big boxes, and they get a head injury. You can bleed out and die. You can get intracranial bleeding, fractures, post-concussive syndrome that can last years. Holy cow. Oh my God. A nail gun that is still attached to the air compressor without a safety mechanism. It can go pretty far and deep, but man, that's pretty far through bone. Watching and treating injuries like this can be a little stressful, and that's part of the reason that I helped formulate something called Chillax. It's a supplement for occasional stress support. Check it out at lifehappens.com and on Amazon. Oh, bam! I wasn't expecting a screw into the foot. Ouch. Rusty screw. Hopefully the tetanus shot is up to date. No, I'm just kidding. Tetanus. Doesn't necessarily cause tetanus, but it's just something that we worry about. Depending on where that landed, it could go straight into the bone and get stuck. It could just go into the soft tissue, but it hurts a lot. The skin is very thick on the bottom, so once it actually goes in, it's actually quite painful. Okay, just fall down. Okay, okay. Oh, sorry to laugh. That is so wrong. Thoracic hyperextension and then massive amounts of lumbar extension as well. That's why those legs are all the way back, but you just see bones popping out everywhere. So she probably snapped her neck. Oh! Oof. Oh my gosh. He got so lucky. When you fall from great heights and you land on your feet, ouch. You can land on your heels. You can snap your calcaneus, which is your heel bone. If anybody's landed on their feet and they complain of lower back pain, you got to get x-rays of the whole spinal column because you can have a compression fracture at any level. Oh my gosh. He landed on glass, and so you can have the glass of shards in your back, cause a lot of lacerations, injury. Sometimes it gets stuck in there. We can't see them to get them out. Sometimes you can see it on an x-ray, and then a lot of times if we can't get it out, they will come out like a splinter. Yep. Oh. Wow. Rupture of the eye, but behind the eye is obviously your brain. The skull is pretty thick in the frontal area, but behind the eye, it's a lot thinner.
Could you be a little quieter with that thing, please?
Yeah, sure. I'll just put it on quiet mode.
That would be good.
Oh my God, he killed her. Oh. Oh my gosh. I don't know the mechanism of airbags, but they do come out with massive amounts of force. People come to the emergency department often after car accidents. They do get concussions from the airbags. They get burns from the chemicals of the explosion of that airbag. But again, the airbag is saving your life. Oh man. Wow. The amount of force that it takes for barbed wire to rip somebody in half so cleanly. We do see organs. The classic intestines, yes. But you would see at the top part here that this is potentially the liver and potentially the kidney. Oh, it could be the stomach as well. That was actually quite impressive. Tire caused enough head trauma to make that head just go somewhere else, and so we know that's not compatible with life, and you're going to have significant amount of blood loss. We know at this point that blood loss doesn't really make a big difference. Oh, that's not good.
Not good.
Having that much weight fall on top of you, causing crush injuries. This crush injury probably not sustainable with life, but the big things we want to look at, A, B, C, D, and E, right? Oh. Speed, sharpness. It's a blunt trauma injury, but it's so fast. Splitting somebody in half. Is it survivable? Unlikely. Bleeding out is your biggest issue, and then thereafter you're having issues with organ failure due to multiple organs that are injured. I don't think I ever want to go to a NASCAR race. How would that immediately end life? If it causes your heart to stop immediately, penetrating trauma to the heart, blood loss to that area, or blunt trauma that crushes the ribcage so much that it impedes your ability to breathe. But again, you have time. So a lot of these injuries aren't going to be instantaneous. I can't believe that. That is the worst luck. It has to still be a lot of force to have that blunt of an end penetrate through your skull. It doesn't necessarily mean it's actually penetrating the skull. It could be right below your occiput. So it's just going through maybe the soft part of the neck. Okay, first off, I will tell you, I am not a fan of roller coasters. If you are, let me know in the comments. No, I called it. See, drop the camcorder. I literally call it a camcorder because that's what they're used to be called, a video filming device.
In England, we call it a film pod.
Oh my gosh, those poor people. Being launched like that is almost similar to being launched out of a car in a car wreck. Whatever you land on, concrete, grass, a pool, sand, going to be coming fast and cause significant amount of damage. You're gonna have a lot of broken bones as well as blunt trauma. Oh, horses do cause trauma to individuals. Most of the traumas that we see from a horse actually comes from people falling off the horse. If you get kicked in the chest like that, really high suspicion for significant trauma. You might see pneumothorax on an x-ray. You might need to do a CT scan of the chest. Propane. Oh, that insult to injury. Flash burns to the face. This is actually common in the emergency department. People cooking at home or using a grill outside. If there's soot in the back of the mouth, singed nose hairs or eyebrows or eyelashes, it can indicate a more internal burn that got into the airway. Lots of chaos and stress at the fair.
People die at the fair.
People die at the fair.
These people could definitely use some calm vibes in their life. Part of the reason I formulated Chillax, an occasional stress support supplement. It will help aid in relaxation against all of life's occasional stress moments. Definitely check out Chillax at lifehappens.com or on Amazon.
You're dead!
Well, I don't think there's any coming back from that one. The classic appearance of your small intestines just laid out. Not being gross, but you would normally see like more brown stuff per se. You're seeing a significant amount of the red stuff, and that's because your aorta, major blood vessel of your body, goes down into the abdomen. Don't use those type of scissors up your nose because you're gonna slip, fall, and jam it into your skull. Buy yourself some nose clippers. There are many different types out there, super easy. Zoom, zoom, fine, maybe help hit those ears. Good job. They show redness to his eyes, which is trying to tell us that he's having subconjunctival hemorrhages due to pressure and strain that can pop. If you push too hard when you're trying to have a poop, or if your blood pressure might be too high, you can actually have a popped blood vessel in the white parts of your eye, which are dangerous. So interesting, he can't stand up because it's so slippery. I wonder if he just took a break for a second, he might be able to put his legs on the side. Oops, passed out. In that scenario, he hadn't died yet. He just passed out. He still has time, but unfortunately, there's no way for him to help himself. He needs somebody else to free him. And if somebody was there in time, he'd probably be okay. Holy cow, what horrible scenarios. Those metal blades can cause significant amount of issues. The Jackass squad has shown us many videos of them jumping into fans and being relatively okay, but don't do that because if you hit it in the wrong way, it can cause significant lacerations. I've had people come into the emergency department with pretty gnarly lacerations with fan apparatus. Oh, what the heck? You need to wear eye protection when you're doing lawn work. You just never know if something's going to be thrown up with the devices that you're using. This person would not normally be wearing eyewear, but it also goes to show you should be using a bag to collect the debris. That way it doesn't just fly and hurt somebody. Wow. Straight through the eye socket, the window to your soul. No, eye socket goes directly back towards your brain. You have your temporal lobe, your frontal lobe, parietal lobe, and occipital lobe. Would this make somebody lose consciousness? Maybe. Would it have their heart stop right away? No. It depends on the amount of brain tissue that's been damaged.
Who wants to be the first to tell me what the hell just happened? Who's what?
Oh, man. Could definitely do this to somebody because of the speed and the weight of the wrench. Blood, kind of appropriate in what you're seeing pooling. It's very dark. You wouldn't see it as bright because there's probably more venous blood than arterial blood coming out. Right behind your eyes, your frontal lobe, but then going further back, you're going more underneath that frontal lobe right into your midbrain. All of a sudden the person is out cold, unconscious. This person could just be massively like brain dead versus did it hit that area and cause you to succumb to the injury. Oh. Okay. This is like one of those classic lifts to help somebody get in and out of the pool. We actually use these at the hospital as well. We call them Hoyer lifts, but they're basically lifts to be able to help move individuals so that way the people moving them don't hurt themselves and it's comfortable for the patient as well. Whoa, okay, so somebody intubated, so that's a breathing tube into the airway on a ventilator. Actually quite appropriate. You got an IV line going behind, and that is a classic tube holder that somebody would have in place. Sometimes if you don't have a tube holder, you can actually use a piece of tape and twist it around the tube as well. Oh, come on, getting electrocuted. Come on! Hospitals use so much energy because everything requires electricity. Hospitals actually have really good backup generators as well. Oh, it's a lot of water. Nobody's noticing this massive amount of water. Come on. Come on! Pools up on high floors. I mean, shouldn't they be down like on ground level or below ground? Oh, so he was able to extubate himself. At the end of that breathing tube, you have a balloon cuff that keeps it in place in the trachea. You pull that out, you can actually rip your vocal cords, really injure them. What? Come on. Come on. That amount of water, gallons and gallons of water, the amount of weight that is going to crush the individual as well as potentially drown them. Maybe the initial impact is going to cause a significant amount of trauma to this individual, which then could lead to the demise. Wow, cool. We get some x-rays. Run over by the car. All the ribs, the spine falling into pieces. Comminuted, displaced. What that means is all the structures that the ribs are protecting are going to get destroyed as well. Oh, getting driven by the truck into the wall, causing rotatory injury to the cervical spine. You see all those jagged lines on the skull? We all have them because our bone was actually fused. It's interesting that they give us a little bit of the red stuff, even though it's an x-ray. You wouldn't see that normally. All the teeth come flying out. The teeth are actually pieces. That means the roots stayed in and the teeth all just fractured. If this happens to you, go find that tooth. See if it's something that we can potentially put back in. But if it's broken like that, the likelihood is no. Oh, wow. I mean, sometimes you feel like you need to get a good massage, but not that aggressive.
Ooh, are those things even sterilized? No, I'm not catching any diseases unless I've earned them.
We won't talk about that. But this is acupuncture, a traditional Chinese medical technique to basically help bring about balance and healing energy to the body using very, very fine needles. I've actually even had it done to try to help relieve muscle spasms. Oh no.
Oh. Hey, fire!
When somebody gets a burn to the skin, 1st degree, 2nd degree, 3rd degree, and even 4th degree. Holy cow. First degree, it's like a sunburn. Second degree burn will cause blistering, will pop, and then your skin will heal. Third degree burn, everything is charred, won't heal on its own, needs to be replaced with skin grafts. Fourth degree burn, it's all the way down into the muscles and the bones, and really not a good scenario. Come on. Come on! They even show like the top piece of a vertebrae just like hanging out there. We got different types of material. Softer brain material, you got skin, you got skull. Typically, if this were to happen in real life, you wouldn't get that much splatter. Oh, I love the intensity of the propane grill.
Propane.
Okay, normal behavior. Oh my gosh, so you heated up the mug. Now you're gonna put something super cold, increase the risk of cracking the mug. Duh.
Knew it.
If you're like me and feeling a little riled up after watching these clips, you should definitely check out Chillax by my company Life Happens, an occasional stress support supplement to help you find those calm vibes and unwind. Find Chillax on our website at lifehappens.com or on Amazon. Oh, come on. Come on. Remember, don't pull it out, but this is the classic reaction that people get. Depending on where the injury is, if it's a vascular problem, you literally now have a faucet of an open bleeding vessel. Where this stab wound is actually probably a little low relating to the heart. That's like the lower part of the sternum, right at the xiphoid, maybe the epigastric area where the stomach is. You might want to go potentially a little bit higher and to the left. That way we know, okay, it's definitely the heart. Oh, what was that? What would you do if you saw that? I don't know if I would even handle it like, well, like what the heck just happened? Is this survivable? Probably unlikely. The potential is this individual might still have a pulse. They may succumb to the injury pretty darn fast, but you don't know. So you do need to check. Oh, what the heck? The amount of brain tissue that's gone, this would likely not come to the emergency department, but I have seen patients that come in with exposed brain matter. We still resuscitate to a point, but a lot of times once we see that and they're not alive, we stop.
In 30 seconds, the pendulum will drop far enough to touch your body. Within 60 seconds, it will cut you in half. All you have to do is destroy the things that have killed your hands.
Wait a minute, what would you do?
What would you do?
It just slices through the top of the abdomen. You have to deal with slowly bleeding out, and you have to also worry about infection. But if you get deeper, if you rupture your abdominal aorta, you're gonna bleed out super fast.
You must insert your hands and push the buttons to start the devices for you. Your bones will be
if you get your hands cut off, you have arterial bleeding, but it's a smaller blood vessel, so it'll take a little bit longer period of time, and it's a lot easier for you to get bandages to them. Obviously, it's kind of hard with nubs, so to speak. Save yourself, man. Let's go. See, he's trying to get out of it. What do you think? No, not gonna work. Oh my gosh, I'm getting nauseous. How long would it actually take for somebody to die of these injuries? It depends on how much blood is actually pouring out of your body. Some people have lost blood over a very slow period of time and the body's been able to compensate.
I ain't got time to bleed.
Versus in an acute injury where you just pull out blood. Like thinking about this from a realistic standpoint. Go, man. Go, 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 go. Oh, it's slow. A lot of the red stuff, the hands, they're getting crush injuries. A lot of times crush injuries don't bleed that much. They ooze out because you're not actually slicing, you're actually just crushing the tissue. But until it gets even deeper, will you have that significant amount of bleeding. Now this gentleman is quite skinny, so he doesn't have a lot of adipose tissue or fat underneath his skin. You have a higher chance of definitely hitting major blood vessels. In the abdominal wall, you're actually worried about some blood vessels that are kind of on the side of your six-pack, so to speak.
Here is your first test.
Oh, it's got a CPAP machine on, or a BiPAP. That's actually a pretty good mask. Typically, we use that type of mask in somebody in the hospital who has sleep apnea, or say they have bad CHF, congestive heart failure, to where they have fluid in their lungs and they can't breathe.
He's got fluid. Your health and hereditary background put you in the highest category of success. The same cannot be said for your adversary.
Oh.
Well, only 52 years of age. This man has continued to smoke even though he has a history of high blood pressure.
We actually do use it in people who have bad COPD, chronic obstructive pulmonary disease, which is a combination of chronic bronchitis and emphysema. It's due to people smoking. Sometimes it can be a hereditary deficiency as well.
This demonstrates very little appreciation for the blessings of his own life. Your game will focus on a simple element.
So it's interesting that he calls it a game. This almost reminds me of Squid Game, that show on Netflix where they have to do different things between life and death.
Once this game begins, every time you take a breath, the clamps around your chest will close in and crush your body. The only escape is in the other's failure.
What? In a situation where you're freaking out and your adrenaline is up, you're gonna breathe faster because your cardiovascular system is working hard because you're anxious. To be able to try to slow down your breathing, you gotta get into a Zen place, and I don't know how you can get into a Zen place in this situation.
You're messing with my Zen thing, man.
Ooh, big breath. Oh, no. Oh. So very common when people get very nervous, scared, they'll urinate themselves. It has to do with the muscular control of the sphincters relating to the bladder itself. Oh. In this situation, the person died immediately. Could that really have happened? If you have such an injury to the heart itself where you rupture one of the ventricles, yes, you're going to die very, very quickly because you're going to pool blood out. You're going to be unconscious first. If it doesn't get fixed, you're going to die.
I want to play a game. It's right before your eyes.
Oh no. He put the key behind his eye. I want to know how he's got surgical skills to be able to do that. There's a lot of muscles in the way of that. How is it actually just resting behind there? We don't have that much room and extra pockets to put things. Oh, don't pull the device. Oh my gosh, he pulled it. Nothing works well out of aggression.
Until you learn to master your rage
will become your master?
Oh my gosh, he's got a scalpel. It looks like it's either a 15 or a 10 blade. Oh, that's so hard to do. My one suggestion would not be to cut through your cornea, because the cornea is the highly sensitive area of the eye, which is basically the clear coating over top of your iris and your pupil. Super painful if you touch it. So I'd go to the white area where there's less nerves. You couldn't do it. Oh, man.
That's a shame.
Could you do it? You can injure the eyeball itself, get all the fluid out, squish it, move it out of the way. The other thing you potentially do, cut here at the side, but the issue ends up being you have all the muscles and the optic nerve that are keeping the eye in place. So those have to be cut. Oh geez, why is she like, was she like given something? Maybe she's waking up. Oh, there's a syringe with yellow something in it. The only stuff that's yellow is TPN or a banana bag. TPN is what we give people who can't eat, different electrolytes and nutrients in there. Then there's a banana bag, which is very similar. It's like a multivitamin that makes it that color. Oh! Oh no! Oops, and now her hand is caught. No, don't put two hands in. If she had just one hand in there, she could at least lift the blades out of the way, but now both hands are going to be stuck. Oh no, yep. Yeah, oh my gosh. So a lot of times we'll have people who do have wounds like this or superficial wounds that we just have to sew up. Really easy to sew these lacerations back together unless they're deeper to where you have tendon injury or a major vessel. Sometimes you can actually injure a nerve.
Whoa! What the is that?
Whoa.
It's the tool. The tool that's going to save your life.
The tool that I use in the emergency department that saves the most amount of lives the quickest is probably the defibrillator. And then obviously the staff there is an instrument in itself. Without them, we wouldn't be able to save lives.
As a drug addict and a thief, you preyed on the kindness of others to fuel your addiction.
A lot of people suffer from substance-related issues. We have resources to help people, but you can't force anybody to help themselves. We'll help guide, but I can't actually set that up for you.
Just lean forward into the knives with your face. Press hard enough.
Oh gosh.
And you'll release the arm or leg restraints that bind you.
Your temporal artery sits right here in the temporal area. Feel like that would get sliced right open. It's a small blood vessel. You can hold pressure to it once you're through this. Sometimes arteries have to be put back together by a very skilled and trained vascular surgeon, or trauma surgeon can do it.
You can sit idly and bleed out on the floor. Live or die, Cecil.
You're gonna go in and out of consciousness. You're gonna become delirious from not being able to sleep. You can not eat for many days, but you need hydration. Your body's gonna start shutting down even if you don't bleed out.
The timer expires. The door in front of you will be locked forever. Just one hint as to where that key is.
Oh, no. Not good. You gotta use some sort of protection. Literally at work, whenever we're finished with the needle, it has to go into a sharps container so that way it's not just left in the trash by accident, left on the counter, and you don't know. Like, as a physician myself, any needle that I use, I literally make sure that I put that away.
It will be like finding a needle in a haystack. Let the game begin.
If the needle still has some blood in it, you can actually inoculate somebody else or inject it by accident, and there could be bloodborne pathogens that might be transmitted that way, like hepatitis B and C, and then obviously HIV. Oh! 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 Ah! Ouch. It made it sound like it was like glass, but all of those syringes are probably plastic, but the needles themselves are potentially all metal. Ow!
What's wrong with you?
She found the key? How the heck did that happen? Oh my gosh, yeah. You had enough time to put the key in and you screwed up. Oh my gosh.
You idiot!
I know some people are terrified of needles. I've seen many people pass out in the hospital from needle sticks, but I always tell them, don't worry, this is the best place to actually pass out if you're gonna pass out.
Safest place in the world to be.
Hello, gentlemen. You came looking for the game. Congratulations. You found it.
Oh, found the game.
Players.
Never good when there's a weird contraption around your neck, especially with like this weird breathy voice coming over the loudspeaker. It is literally like the seat collar from hell.
Can't be. You may recognize the device around your collar, Dr. Nelson.
Dr. Nelson.
These laser cutters slice through tissue and bone.
Oh, laser cutters. We don't get to use those in the emergency department. You gotta be probably really careful with them. They might be attached to robotic arms or something that's super stable versus these free-form devices.
You both have an opportunity to live. All you need to do is confess. It's that easy.
Oh my gosh, oh my gosh. I wonder if those lasers can actually cut through other material outside of flesh. Why wouldn't it be burning a hole through the ceiling as it just went up?
I confess. Yeah. Okay, all right.
Oh.
All right, John Kramer, it was me. It was me. I messed up your x-rays.
Oh, he was doctor that messed up the x-ray. Sometimes doctors actually do mess up. They're human beings and they either dictate or write something in the wrong chart or leave something out. They might have missed something. These things do happen.
I should have been there for you. I wasn't.
Oh, I was expecting his face to be cut like a cake where it was into pieces, right? How quickly could somebody succumb to these injuries? Just all depends on how quickly the blood is leaving the body.
The device you're wearing is hooked into your upper and lower jaws. When the timer in the back goes off, your mouth will be permanently ripped open. Think of it like a reverse bear trap.
Oh, I've never seen any bear trap injuries in the emergency departments that I work, but I bet they do occur in areas where hunting would go on. I work more in an urban setting, so the likelihood is a lot lower.
There is only one key to open the device. It's in the stomach of your dead cellmate.
Oh, what? Oh, no, don't freak out. Okay, you got the lock. Remember, if anything gets attached to your head, don't just like rip, turn around. You don't know if it starts things, okay? Oh, he's not dead. I wonder if he was given certain medications to keep him from being able to move, or was he paralyzed from the neck down because he was opening his eyes. Big, huge scalpel to the abdomen. I definitely wouldn't be chopping that way. If you're gonna cut the abdomen open, you want smooth stroke like what they do in surgery. And then just do a layer by layer, get in there, move tissue around, spread it open so then you can get to wherever this might be. Oh, she got lucky. Is it ripping your face off, but is your airway still intact? Rip all the way through to where it messes with the spinal cord in the back. Depends on where the fulcrums are and all that stuff. I hope I never find myself in a situation where I would even have to deal with that.
The human body is a miraculous creation. Ever wonder how far the arm can twist?
Oh my gosh, for twisting? It looks like it's screwed into the hands and the feet. So you can actually go between the bones of your hands without fracturing. We see injuries where people accidentally get a nail and the bones are actually fine. It squirts right through.
Are you willing?
Have mercy.
To take a bullet for the man who killed your son?
Whoa. Oh! Rotating, that is so painful. When we have somebody who dislocates their shoulder, we'll actually do external rotation of the shoulder. It's hard to get it all the way to 90 degrees. Now you're actually rotating in this direction even further. Ouch. Ouch. Oh, so it's held in place. It looks like it's rotating at the elbow. We're made to rotate like this. It's called pronation and supination. It's made to do that, but not to great extremes. Oh, the leg. Oh, the leg. Oh my gosh. Oh, no. 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 We don't see too many rotary type injuries. Typically, there'll probably be more of a snap of the tibia itself. The patella can go side to side, but that's easily fixed.
The device you are wearing is hooked into your rib cage. By the time this tape is finished, you will have 1 minute to find a way out.
You got hooks or barbs stuck onto the ribs. We actually do procedures where we cut open the chest and lift the rib cage off.
There is a single key that will unlock the harness, Carrie. It is right in front of you. All you have to do is reach in and take it. But do it quickly. The acid will dissolve the key in a matter of seconds.
There's a bunch of different acids that we always worry about. Hydrofluoric acid, hydrochloric acid, bad pHs that will burn tissue. Oh! You can still actually live for a little while with the ribcage gone.
She's gone!
It's a protective layer. When you fracture and break off all those ribs, you're gonna have some bleeding. So it causes a lot of pain. Are you going to die right away? No, actually. So that one's very, very interesting.
Once her device begins to rotate, it will pierce her eyes and mouth. Step into the other machine and lift the bars to the highest position, long enough to close the circuit, slowing down her device.
So rotate to enucleate.
Nuclear.
Gouge the eyes out. But then on the opposite side of the eyes, you got your brain. If it penetrates deep enough into the brain in certain areas, it may not be sustainable with life. Oh, every time he lifts it, he's gonna get punctured into the abdomen. Oh my gosh! If you're getting impaled in the abdomen, going through the different muscle layers, and then you have omentum that sits right underneath the abdominal wall muscles, which is like a fatty layering over top of your organs. Oh man. Oh my gosh, see how they're actually cut? They're actually beveled. Beveled just like any type of needles that we use when it comes to IVs that are hollow like that. One end is like a point and then it's like a cup, but it's sharp all the way around, and it just has to do with getting into tissue a lot better. Oh, goodbye. Pain in your eye would be of like the cornea, which is the clear cells that are over top of the colored parts of your eyes. Super sensitive to painful stimuli. And wow, I've never seen that type of impaled type injury to someone's face. I don't know if it would be like a fountain of blood like that. Obviously there'll be some blood, but there was a lot of extra red stuff, if you know what I mean. Ooh. All these like contraptions, just having previous experience discussing medieval and dark age type contraptions, these are just as bad or even worse. Fluid. Is he gonna drown him? Is it just water? Yeah. Somebody can hold their breath for 30 seconds to a minute. It's different for every individual, and it changes from being in a calm situation where you're holding your breath now to where you're kind of freaking out, increasing your oxygen more to your tissue. So you actually really need to calm down. Obviously, so much harder than me just saying it. Trying to use a knife or a pen to try to break the glass. Oh my gosh, holy cow. So, wasn't expecting that. He takes out this pen and does his own crike. He's putting it below the Adam's apple. You want to pop right in.
Pop, pop, pop.
To your trachea, below your vocal cords, and you can start breathing. That's pretty impressive. Wow. I don't know if anybody's tried to breathe through a straw. It's actually kind of hard. When we intubate somebody at the hospital where we put a breathing tube in, we actually try to use the largest we can. Typically try to get an 8 French in there. So a good sized tube.
One who has given the most flesh will release their bindings, while the gears on your opponent's head will engage, piercing their skull. Who will offer the most flesh?
Offer the most amount of flesh?
A pound of flesh.
Fingers and tissue and arms. And, oh my gosh. Oh my gosh, the screws in the head. Awful. That is actually your temple area. When somebody actually needs a halo for cervical immobilization, that's kind of an area where they're actually do it. Ouch, but these are like rusty old screws. Holy cow, get to cutting some tissue off. Oh, he's cutting his own skin. Oh my gosh. Did you know that the skin is the largest organ of our body? Oh, tourniquet. Oh, using a tourniquet. This is like the ones we use at the hospital. A little bit of blood flow to pump up the veins so you can engorge the veins so you have an easy shot to get an IV or get blood drawn. And then you actually take it off once you actually get in the vessel. So you're probably going to be using this to decrease the blood flow to chop off our own arm. Cutting off a finger, that's hard. I'm not gonna be able to cut through. Oh my gosh, they're doing it by weight. That guy has such an advantage because of the adipose tissue or the fat tissues that he has. But it is painful. The girl has to worry about bleeding out. I don't know if that tourniquet's going to be tight enough. It needs to be super tight to stop the flow 100%, and it actually is quite painful, but probably not as painful as missing a limb. There you go. In this circumstance where it was amputated, you definitely have a higher chance of having something called phantom limb syndrome, where you still actually think that the limb is there. Hopefully, in this circumstance, if she gets out, maybe she can keep her limb, and because it was such a clean wound, you might be able to reattach it. Hopefully that weighs enough. Things that we see when people come to the emergency department when they actually have an amputation, typically it's not a smooth cut like that. Typically it's all broken tissue, bones are all in pieces, and it's just one big mess.
It's a mess!
Whoa. Screws going that far in, again, causing bleeding into the brain. Would it actually cause you to die right away? Probably unlikely, but it will make you die quickly, but not that fast.
Make the simple blood sacrifice that I've requested.
Oh, Nelly. Whoa. Looking at the blades, they are probably 3 to 4 inches maybe in depth. That's going to potentially go into your thoracic cavity where it could actually sever part of the lung, sever basically part of your heart. Oi! So, laceration to the forearm. Obviously, we're going to get an x-ray if that comes into the emergency department. We'll get the bleeding to stop.
I just don't know how to make them stop.
Because it's on the forearm, we typically will actually use lidocaine with epinephrine. The epinephrine will actually constrict the blood vessels, so you have anesthesia for a lot longer.
Cut yourself! You need to cut yourself! You want blood and then you're free!
You can take off your own finger. Oh, wow. When we see people who come into the emergency department with all these lacerations, typically they'll actually go to a certain part in the emergency department where it's more like a fast track. All you need to do is make sure the bone's not injured, maybe an x-ray, make sure there's no foreign bodies, and then have the wound looked at, anesthetized, cleaned out really well with water. Depending on how deep it is, you may need to do multiple layered closures, or do you just need to be able to bring the tissue back together? Typically in the emergency department, we do simple interrupted sutures where it's one individual with multiple knots, depending on the size of the suture.
Help! Hey, help! Help! Please!
Whoa, what is this contraption? Those look like really bad optometry lenses when you go to see the eye doctor and you do the, is it better now? Is it better now? That's like a scary version of that.
All you have to do is click the dial across the 5 positions,
All right, we got it.
Live to see another day. You have 60 seconds.
I don't know exactly what's on his fingers. They actually almost look like these things called finger traps that we use in the emergency department that actually go over top your fingers and hold your hand in place that we use if somebody has like a fracture. Oh, wow. Hyperextends the finger, probably fractures it and dislocates it. Just do it all super fast. Suction? Did it just suck his eyeball out? The amount of force that takes, that it's able to tear the 6 muscles and the optic nerve and the blood vessels all out all at the same time. I'm not sure how it actually happens. What? Oh my gosh. What? Holy cow. I was not ready for that.
Oh my goodness.
Horrible, awful. Have I actually seen somebody's eyeball totally out? Actually, no. I've seen a lot of traumatic injuries to the eyeball itself where there's lacerations, there's blood coming out, but not being suction tubed out of there.
Attached to your arms are 2 explosive devices.
Whoa.
The blades cannot cut through the galvanized cable, but they can slice through flesh and muscle.
Having to actually cut yourself with these, the first incision will hurt for about a second, and then after a few cuts, it won't be as bad.
Considerably.
It's hard to see exactly how deep having to cut into the tissue, but it's into the forearms, right? You're cutting through soft tissue, you're cutting through the nerves. You can hit major blood vessels. They're deep inside. They typically will run kind of closer to the bones, so they're protected. Okay, he conquered this. Could he bleed out? If a major artery in the forearm is lacerated and you don't get control of the bleeding by compressing it, holding pressure to it, could you bleed out a lot? Yes, but would it make you die? It's hard to know. Your blood pressure will eventually slow down, so the amount that it's forcefully coming out will actually start to slow. Concerned the injury there would be perforated eardrums, tinnitus, ringing in the ears, almost like concussive type forces, as well as potentially hemothorax or pneumothorax relating to injuries to the chest itself.
There are more than 5 pounds of marrow in the human body. All you need is 3 ounces.
Talking about bone marrow, where your precursor cells for all your blood cells are, within the meshwork within the bones.
There's more than enough in your femur. Just suction it out will be transferred to that device right there.
We'll do bone marrow biopsies in your hip, and a lot of times we'll use bone marrow to help somebody who needs a bone marrow transplant when their cells are potentially cancerous and they're not functioning the way that they should.
Other way, Phil. Wrap it under your legs.
Oh, so she has to amputate off her own leg using a bone cutting saw, which I've actually used. You just want to do it fast and quick and with a lot of force. Woo! There you go. Oh my gosh, she was able to cut her own leg off. So now the issue is your femoral artery is bleeding, your veins of the leg are bleeding. You potentially can bleed out pretty fast, so you need to get moving.
You're running out of time.
So this looks like one of those suction devices at the dental office. Sorry, a dentist out there. We have similar suction devices. Our suction devices are plastic, so we can be thrown out. That's messed up. Come on.
Come on!
When your head is removed from the rest of your body and no more connection, the question ends up being is how long is the head still conscious? And there's no way to specifically tell this. They've thought it back in the day when there was some eye movement and maybe there was some awareness. Unlikely.
Less than 3 minutes. The enzymes.
3 minutes to cut off your own skull?
A circuit. This will save your life.
So you gotta make sure you don't cut the wrong piece of brain out that has to do with motor function. Oh my gosh! Oh my gosh, that gave me like the heebie-jeebies. That drill bit is only about 1 inch long, maybe a little less. Might not hit the brain tissue, but you're gonna cause brain bleeding, you're gonna cause pain because of the meninges, which is the covering of the brain. But once you get through that, the brain itself is actually insensate. It does not have pain receptors. So it is kind of soft, kind of gelatinous, weird feeling. Yes, I felt someone's brain before because I deal with traumas. So it could look like that and have that same kind of texture.
Hello, Gabriella. I want to play a game.
No, stop it.
Just watching these clips gives me like stress. If you guys are in situations where you're more stressed than you want to be, definitely check out a product that I've helped put together called Chillax. It's mood stabilizing and helps with healthy stress management.
Radiation machines are not to be trifled with.
Radiation exposure, cellular breakdown. So we use radiation therapy in medicine to help target tumors, cancer cells, to shrink them down, to try to basically kill the cells themselves. Gonna try to like break the bone out. Look at it, skin, flesh melting. It's like a hammer. Awful.
That's awful.
Obviously, in this situation, she's just happy to be alive. You need to get to the hospital. The priority is getting the joint back into place because it significantly reduces the risk of long-term arthritis to that joint the faster you can get the joint back in. Oh, Jason Voorhees in the building. Oh, okay, wait a minute. A lot of times people smash their face on the ground or a wall and their skin just splits right open. The trauma of the tissue hitting a hard surface actually causes it to break and split apart. Then obviously you're worried about skull fractures and getting concussions, it can cause some bruising. The first things I think about, whiplash injuries.
I think I got whiplash.
Then we actually see people who get their hair ripped out. I've never seen somebody manually get their hair pulled out as well as the scalp. Typically there's some other trauma to where the hair then would lift off. I was drowning her. Oh, what is that? Oh, liquid nitrogen! Holy cow, that was super cool. That could actually happen.
You don't know it could happen.
It definitely does not make the sound of shattered glass. People actually do come to the hospital with traumatic injuries to their face, and you can just put a tube right in there. And you can oxygenate the person, and obviously it's gonna need multiple reconstructive surgeries. Oh, look at it. Oh, look, this is the table of like joy for just this type of person. None of these are potentially medical tools that I would use in the emergency department, except for maybe there's this one little one. It almost looks like an ear curettage, basically where we would take earwax out of someone's ear. Some weird, creepy doll. Freddy Krueger comes to you in your dream. Sleep stages have to do with our own brain waves. It allows us to have these potential subconscious thoughts. Sometimes people remember them more vividly than others. It spans a whole spectrum of what dreams and nightmares could actually mean, just causing nasty lacerations. Freddy Krueger, his whole body has scar tissues, and you see those like really thick lines. And what happens over time, they actually get tighter and tighter. Then is a plastic surgeon or burn surgeon can change the direction of it and then reattach it, and it actually expands the tissue again. Oh, what? That is so cool and interesting that they would actually depict things like that. He's pulling out his blood vessels. The blood vessels are intact, and he's using them to tie him up. Just like that puppet doll, he's gonna probably dangle him, I'm assuming. Yep. Yep. Oh my gosh. The blood vessels in our body are a little stringy because they're made up of muscle. A lot of times if a blood vessel is actually cut due to trauma, they actually retract. So you actually have to try to go find them. You obviously probably have more bleeding than was actually occurring because of the other vessels that are around there, the small capillaries that are cut versus these big major blood vessels. We've talked about falling. If you fall from a height that's 3 times your height, it's a major trauma. 3rd story, 2nd story. This is like way up there. Major increased risk of death when you fall from such a height, especially depending on what you're falling on. What? Oh, we got blood. I don't know why this lady's freaking out or being weird and looking like she's possessed, but maybe she's in shock, and our bodies do weird things when that occurs. Sometimes people are like a deer in headlights and they can't move. Lady falls to the ground. Oh, we got shoes. We got some pants. We got a knife. Yes, we got Michael Myers. Oh. So multiple puncture wounds, probably through the back torso area. Gonna go into your lungs, most likely. Your heart is protected in the middle, and in the back, you have all your vertebrae that are in the way, as well as the ribs. Oh, we got Scream. Nice. Breaking through the glass. When we're dealing with that in real life, we actually see people who have lots of lacerations. Sometimes you can't get all the glass out, which isn't a big deal. People literally will freak out. The body will actually figure out a way to work it out, and then it'll come right out.
Then they come out here.
And a stab wound to the abdomen, guaranteed, right? No? Oh, into the chest. Stab wound to the chest, you have your sternum, and then you have all the little lumps that you can feel where the ribs hit. So if you hit the bone, it ain't going very far. But anytime there's a potential wound like that, we're gonna get x-rays, a CT scan of the chest, as well as get a 3D view of what's going on there. Strangulation injuries. The biggest things that we worry about are actually injuries to the intima, the walls of the blood vessels in your neck. Sometimes you can complain of like a headache or discomfort in your neck, and we'll actually do what's called a CT angiogram of the major blood vessels of your neck, just to make sure that we're not missing tears or new formed spaces that can form in that area. Oh, you stabbed her again. I can't tell because it's dark. Just by the way, the sound, it's definitely probably neck. Classic sound that you would hear having airway compromise. Injuries to the neck. We worry about the zone 2 area where you have these major blood vessels, jugular vein and your carotid artery.
It's up.
Chucky's put together by staples. We'll use staples on the scalp, but we won't use them on people's faces. We don't want to potentially increase the risk of having scars next to the scar that's already formed. Have you guys ever had staples placed? Let me know in the comments. Oh my my gosh, I was not ready for that. The amount of strength and maybe how strong that wire is, I don't conceive that that could happen. We don't deal with very many decapitations that come to the emergency department because it's not survivable. The things you worry about, obviously, are you bleeding out, the spinal cord injury, and the fact that you don't have a head on top of your body that communicates to it anymore. And wait, what am I watching? So now this other doll-looking thing just urinated itself. Sometimes animals, cats, dogs, when they're super excited, they can't hold in their pee and then just let it go by accident. Or in humans, when you're super scared, you'll potentially urinate or defecate.